Unfortunately, sometimes in spite of the best of the efforts, kidneys do fail. After the kidney failure, we have options. There are mainly three options. One is the conservative management. Sometimes the patient at stage of life, they don't want to undergo dialysis. They don't want to undergo transplant. We just do conservative management for those patients. The other option is to do dialysis. Dialysis is very tough. It's a life-sustaining therapy. If the kidneys are not working, then we do the dialysis. The machine does the job which the kidneys are supposed to be doing, but it is very tough on the patients. The patients go through a lot of tough time to go through dialysis. So it should not be taken lightly that, oh, if the kidneys fail, they can always do dialysis. No, the life on dialysis is very difficult for every single patient, and as a healthcare community, we also need to understand that those patients are going through really hardship to go through dialysis. And that's where the transplant part comes is in if your kidneys fail or they are failing, we can, if you are a candidate for getting a transplant, you're healthy enough to get evaluated for transplant, we always encourage them to go and get evaluated for transplant. Transplant could be two ways. One is something called a diseased donor transplant. If somebody dies, then if they're an organ donor, then they can give kidney to somebody else. There is a very long wait list for that, approximately 4 to 5 years.
Wow.
Yes. So once you get on the transplant list, then you have to wait for about that period of time to actually be able to get the transplant. The other way to get the transplant is to get a living kidney from somebody you have. If you have a friend and a family member who is healthy enough and willing to donate you a kidney. And the good thing which specifically I want to point out here is if you have a family of friend who is willing to donate somebody a kidney, they actually do not need to match you.
Really?
Yes. So what happens is if they match you, that's great. You can get their kidney, get the transplant. But if they don't match you, there's a beautiful system here in the United States that all your information goes into a database, and you get matched with somebody else's kidney, and the person who's your friend ready to donate your kidney gives a kidney to somebody else.
Wow.
So it's a mix and match. So everybody's a winner. Everybody gets the appropriately matched kidney. So that's why I always try to tell people who are looking for a kidney donor is to don't worry about matching. Just make sure if somebody is healthy and willing to donate kidney, they can get evaluated, and then everything will be taken care of after that.